Hello, I'm Bailey Swenson. This is an informative speech for fundamentals of oral communication. Here's the family I have with me, and then we'll get started. Hello everyone. Today I want to speak about a topic that is very prevalent in our world today. The war on drugs is at an all-time high, and now everyone is able to do their part in saving lives by making themselves aware of the publicly available nasal spray, Narcan, to immediately begin the overdose reversal process on others. The Surgeon General says, be prepared, get naloxone, save a life. The invention of Narcan, naloxone, in 1971 has been instrumental in the decrease of opioid overdose survivals. According to the CDC, provisional data from the CDC's National Center for Health Statistics indicate that there was an estimated 107,543 drug overdose deaths in the United States during the year of 2023. A decrease of 3% from the 111,029 deaths estimated in the year 2022. This was the first annual decrease in overdose deaths since 2018. The new data shows overdose deaths involving opioid decreased from an estimated 84,181 in 2022 to 81,083 in the year 2023. While overdose deaths from synthetic opioids, primarily fentanyl in America, decreased in 2023 compared to 2022. Cocaine and psychostimulants like methamphetamines increased. Several states across the nation saw decreases. Nebraska, Kansas, Indiana, and Maine experienced declines of 15% or more. Still, some states saw increases. Alaska, Washington, and Oregon stood out with notable increases of at least 27% compared to the same period in 2022. Please note that Iowa decreased by 4.06%. According to Yale Medicine, in March, the U.S. and Food Drug Administration approved Narcan as nasal spray for over-the-counter use, which means a prescription is not required and people will be able to buy it in pharmacies, stores, and perhaps even vending machines. In August, the agency granted a second over-the-counter approval called Revive, a nasal spray from Harm Reduction Therapeutics, a non-profit pharmacological organization. The latter product is expected to become available in early 2024. Naloxone, which can be administered as a nasal spray or by injection, can quickly reverse an overdose from opioids including heroin, fentanyl, oxycodone, hydrocodone, codeine, and morphine. It will not work on overdoses from cocaine, methamphetamines, or other non-opioid drugs. Dr. Catherine Kroc, MD, MHS, a Yale medicine researcher, says that Narcan is unequivocally a life-saving medication that works very well at reversing opioid overdoses. The more it is available in the community, the more likely it can help someone during those first critical couple minutes when they need it. Especially in healthcare, opioid overdoses happen very frequently. In America, we need to cut them down. The Surgeon General of the United Public Health Service, VA-DM, Jerome Adams, has made it clear and encourages all people around those who abuse opioids, people in healthcare, friends and families should know how to use naloxone and keep it within reach so they can save a life. Be prepared, get naloxone, save a life. Naloxone is a safe antidote to suspected overdose and when given in time can save a life. Research shows that when naloxone and overdose education are available to community members, overdose deaths decrease in those communities. It should be noted, in addition to the above patient populations, patient taking opioids as prescribed for long-term management of chronic pain, especially those with higher doses of prescription opioids, or those taking prescription opioids along with alcohol or other sedative medications such as benzodiazepines, anxiety or insomnia medications like buspirone, are also at elevated risk for an overdose. These cases need to be considered to keep our families and communities safe. In schools, healthcare, the grocery store, anywhere you can imagine, naloxone is available for those to use on site and ready to use if something were to happen. We're living in a new world with products now available for everyone to be part of ending the crisis. Please become educated and aware of your surroundings, your families, your communities, your loved ones. You could one day save a life with the use of naloxone. The opioid drug crisis in the United States has been growing for years, but with the invention of Narcan medications, with access to general public, overdoses are beginning to decrease. Therefore, deaths are beginning to statistically decrease. The The CDC and Surgeon General's offices are pleading with all parts of society to be part of this fight and learn how to assist someone who is in an overdose to get immediate help. Families need to have it ready and be aware of their family members if they're suspecting any opioid drug abuse. Dr. William Ray Monroe summarized it best in his book, American Narcan, Naloxone and Heroin Fentanyl Associated Mortality. Drug addiction has many pathways to recovery, but not opioid overdose. Death only has one pathway back to rescue and reversal, and that is naloxone. Thank you.